So as lockdown gets eased, we have to be on standby. We have to be ready to be able to respond and to step up our services as and when required. So the Dragon Heart Hospital is a very important part of our planning to respond to COVID. We built the Dragon Heart very quickly, we established it, we have used it, and we have used it effectively. It's been a good experience for the patients that went there, and it's been a good experience for the clinical staff that went there, because we learned how to provide care in a very unfamiliar environment that the Dragon Heart Hospital is. So with regards to Dragon Heart Hospital, it's in standby now. So the last patient left the Dragon Heart Hospital, we've moved it into standby, but it is ready to be able to be recommissioned within a week if we think we need to. And it's ready with 1,500 beds if we think we need to commission all 1,500. So it will remain in standby if the reproduction rate and the R rate stays less than 1, because if that happens, then we think we will be able to cope within our normal bed capacity within our normal facilities. But if we start to get into an escalating position where the virus is spreading, then we will make a judgment around at what point in time we would need to reopen the Dragon Heart Hospital, recommission the services, and our understanding at the moment is we could do that within a week. So to the public, I think I would just reinforce the perspective that we aren't out the woods yet. The pandemic is there, the disease is still there within our community. It's under control at the moment. We just must not give it the opportunity to start to infect again. It's not about testing, it's not about any of those things. It's about washing your hands, it's about social distancing, it's about making sure you comply with the rules that are there so that we can actually ease lockdown, but at a pace at which we can manage that and therefore keep the virus under control. So one of the things I would say is that throughout this pandemic and even still now, the response of the staff has been fantastic across all of our organisation. That's in primary care, it's in our hospital services, it's within our community services. People have really gone above and beyond to be able to respond, to keep the staff safe, to keep themselves safe and their colleagues, but also to keep the patients safe. But I'd just like to say thank you to the staff for all of their efforts.